green is good.
Big
Oh,
giant
and the
sticker.
yes, yeah. Green is good. Red, you give us or the company a call. You guys might experience, because there's oxygen tubing on all of the machines. Sometimes the tubing can get kinked or blocked or get caught on something. Usually if you see that, you'll see a yellow and a red light. It'll be beeping at you as well too, okay? Most of the machines will have a filter. Usually the patients are pretty good with checking their filter, but sometimes they forget. So if you guys are in the room, just check the machines every now and then. This is where it sucks all the air in here, keeps the oxygen, gets rid of everything else, so it'll get a bit dusty after a while. Either vacuum or rinse it with water, or they can tell the cleaning as well too. But if you rinse it, make sure it's dry before you put it back, okay? We had a patient put a wet one and destroyed the machine, so make sure it's dry. The machine can run while it's drying as well too, so you don't need to turn it off or anything like that, okay? Any questions so far at all about the stationary? The stationary one is pretty straightforward. Usually the therapist will set the flow. I don't know if you guys can see the ball from there. So this is how we adjust how much oxygen is actually coming out, okay? So it's usually the companies that set the flow. If you guys make any changes, just call them to let them know, because they need to know if there is, okay? Perfect. So that's for the room. Now, patients aren't always in the room all the time. I'm sure you guys know they're going down for meals, they're leaving to go on day trips or whatever. Yes, so there's two things. There's, do you want to talk about the portable? Sure.
Okay, so we have what we call a POC, portable oxygen concentrator. Runs off a battery, and you can charge it two different ways, okay? So the back here's got a little hole. That's where the battery gets charged. You plug in the adapter to the hole, okay? Runs off this nifty little battery here that you can take off, which is your first troubleshooting step if it alarms, is to take the battery off, put it back on, you'll hear a beep, okay? That's like resetting your computer, resetting the machine, same thing, okay? So this is your on-off button. You just hold it down for 2 seconds, a second and a half, it turns on, okay? And once it starts up, you'll see that this one goes up to 6. This is just a setting, it is not liters per minute. Like the machine number is liters per minute, this is not. So setting 6 is roughly 3.5 max liters per minute. So anybody that has a flow over that most likely cannot use one of these and would have to go to a tank, okay? So on this machine, I'm gonna turn it off, it creates a pulse. So it's a burst of oxygen triggered by inhalation through the nose, okay? So if they're not breathing through their nose because they're short of breath and their mouth breathing, they're not gonna get as much oxygen as they're not gonna need, and they're gonna need to be reminded to breathe through their nose to trigger the machine, or you'll get an alarm on the machine with a nose with like a burst and with an X through it, showing that you're not breathing through your nose, okay? Other things about this is your up and down. So setting up, setting down, okay? Setting 3 is what most people usually are on, but that's only about 1.5 liters to 2 liters, okay? So like I said, setting is different than liters per minute. You have vents, one on either side of the machine, and just like Sebastian said with the filter, that's what this is, it's a filter. You can pop it off, rinse it under warm water, tap dry it on a towel, make sure it's dry, and then put it back in. The machine can run while that's happening, okay? So this machine comes with 2 chargers. You've got the big wall charger for in the room. Okay. It looks like a power cord for a laptop. Has 2 pieces to it. So this comes apart. Okay? Yeah. So you want to make sure that it's got both pieces. You plug it in and then into the wall and into the back of the machine. The other one, if we have it in here.
It's right.
Thank you. Is a car charger. So if they're going out on a bus trip or in the car with their family, make sure they take their car charger with them. It's got the same adapter to the back of the machine, and then you have the 12-volt adapter. It's like the cigarette lighter, okay? Make sure that you remind the patient not to leave this plugged in when the car's turned off, because it will drain their battery, just FYI. But if they're going out for a long car ride, make sure they take this with them. Okay?
It gets knocked around, the battery will just slip out, just
Yeah.
like that. So if you try to turn the machine on and nothing's happening, always check the battery, make sure it's in place. If it's still not turning on, check that, make sure that it's not disconnected right here, like Lindsay was saying, because sometimes this will come apart and then it's not actually charging the machine. If you tried everything, just call us, because then we can also just troubleshoot it as well too. But more so for you guys, because I've seen it a lot where this machine just gets smacked or it gets dropped by a patient, and then the battery will just slide out a little bit. And it's just an easy fix, is just putting it back in, okay? So, that machine doesn't work for everyone, the portable one. If your needs are too high, if you're cognitively impaired, like if dementia or you have a stroke, that pulse mode is not appropriate, so then they'll need tanks. The main difference with this is this gives you the same as the home machine. It's constant flow, so air all the time, versus the little one, which is just the puff. You guys probably heard it. It's like the little yeah. Do you guys have any experience with the filling stations at all? Yeah. So some patients will have this one. I like this one. Sorry, you're just trapped.
I'm trapped.
Once it's plugged in, it's already on. Yep. Do you see there's a little green light there? So that means it's ready to take the tank. The fill tanks, you can tell if you can fill them because they all have a little nozzle right here, okay? And then either this size, or we have, of course, the half size as well too. So whoever wants to practice after can practice. So you will just push the tank on until you hear the click. You have to hear the click because it locks it in place, just so the tank doesn't roll or fall off. Once it's on, all you have to do is push the big button, the green button. Yeah. So it does a cycle first. It checks how full the tank is, and then it'll start filling. You see here it's starting to fill. Once it's full, of course, it'll show on this one. So when it's full, it doesn't keep filling, so you don't have to worry about rushing to turn off the machine or take off the tank. It just automatically shuts off. So if you're busy with another patient or whatever, you don't have to worry about it rushing. If you want to stop it early, you just push the same button. Okay. And then to take off the tanks, you can't pull it. You have to push down, and you'll hear that. That's normal. That puff up here. Okay, because this is just coming from this little nozzle. Okay. Now, I just want to go through. You guys might know, but I like to just practice this one as well too. Okay. I'll take it off because I have a little trick. Yeah, come closer. Come.